All on 4 is an amazing service. In fact, I've come to the conclusion that it may be the most important service that we can do in dentistry. And the reason is that the people who are candidates for that are really dental cripples. They are in a situation where they've got a lot of broken down teeth, they hate going to the dentist, they're afraid of the dentist, they're embarrassed about their teeth. Sometimes that embarrassment actually stops them from going to the dentist. And certainly I have the greatest respect for people who are in that situation. You know, I'm not here to judge, I'm here to help you. You know, I understand why you get into that situation and then you don't want to do anything because you are embarrassed about going. Nobody needs to be embarrassed coming to me. My only job is to help you and to bring out the best in you. But with All on 4, what happens is we ultimately remove the teeth. You're asleep for this, so it's pretty good. We remove the teeth and then we put in 4 implants, and then within 3 days you actually get a fixed bridge, so it's something that you don't take out, and you can function on that immediately. It is an amazing procedure. We actually have a team of 3 of us who work together on this. We have got the best surgeon, in my opinion, in Australia, Dr Alex Fibishenko. He does the surgery. I went to a course of his, you know, basically to learn the procedure, and I thought to myself, I'm not as good as you are at doing this, so why don't you come up to my practice, you do the surgery, I'll do what I'm great at, which is restoring people's mouths and giving them a functional bite and aesthetic outcomes. That's what I do, and we work in conjunction with my ceramist, who I've actually worked with for 32 years. We have a great relationship and he is awesome. He's by far the best in Australia, and so together we work to create the best outcomes for the patients. And one of my recent patients who we did this for, she had like a compromised denture and some old teeth, and she wanted to have that sorted out. But because it's such a compromise, often they'll have bad necks and headaches and things like that, just like other people who've got pain problems do. She didn't come to me for that, she came because basically the aesthetics and function. But because I do it from a neuromuscular and physiologic perspective, I was able to help all of the structure from here on up. And she says to me, Anne-Maree, I'm not having headaches anymore. I haven't got neck pain anymore. It just feels amazing. I mean, I love the way it looks, but you took all that away from me, for me as well. And it's just such a wonderful outcome. And yeah, it's been a lovely thing. And I think that it really is one of the greatest services we have in dentistry, but it has to be done well.